Well, welcome back to the Daily Refresh. A recent Harris poll survey found that 68% of Americans are worried that the worker shortage in healthcare could have an impact on their own health. Joining us now to discuss is the president and chair of the American Academy of Physician Associates, Folusho Ogunfiditimi. Thank you so much for being with us today.
Thank you for having me. I appreciate it.
Absolutely. So let's get into it. How is the worker shortage in healthcare impacting Americans' access to care?
So the workforce shortage is having a tremendous impact on patient care. Patients are feeling frustrated and anxious about their inability to be able to get in to be seen by a healthcare provider. Our Harris poll that we recently conducted suggests that 75% of patients actually feel like the healthcare system is not meeting their needs. Another 25% actually give it a failing grade. The data also suggests that it's taken on average about 4 weeks or so for a patient to be able to come in to get a medical appointment, or for someone to come and see me in clinic as a clinically practicing PA, for example. And that is just way too long to be able to receive care. And that's why PAs can be a solution to being able to close those workforce shortages that we see around the country.
Absolutely, absolutely. So can you tell us about some of the other findings this recent Harris poll was able to uncover?
Yeah, so the findings were illuminated. Some of the challenges that were identified include rising costs, challenges to be able to get in to see a provider, as you mentioned, and particularly about healthcare disparities across the country. About 40% of patients that were identified say that they either skipped or delayed care over the past 2 years. Another 60% or so waited till they actually fell sick before going in to see a healthcare provider. Those are, put challenges on the healthcare system right now. The good news, however, is though that PAs can really add to those discrepancies that we see in healthcare shortages by improving the access to care.
Yeah, absolutely. And you were mentioning there for just a second, but how will physician associates or PAs help alleviate some of the issues Americans are facing when it comes to accessing this health care?
Yeah, so the PA profession is was one of the fastest growing healthcare professions in the country today. The Harris poll suggests that 90% of patients actually believe that PAs should be part of the solution towards addressing healthcare shortages. Over 90% also believe that PAs can help to increase care and decrease those challenges around being able to get a medical appointment. PAs are trained to be able to deliver care, to diagnose, prescribe, treat patients, and it's extremely gratifying that our patients are now recognizing the value that PAs give. As a clinical practicing PA, I'm able to deliver care, listen to patients, really get into the care that they need and be able to take care of them in a timely fashion. And PAs really are part of that solution.
Absolutely, absolutely. And then real quick, are there any obstacles that are making this care shortage even more severe than it already is seeming?
Significantly, one main obstacle is the fact that PAs practice from state to state, and those state laws may not necessarily be up to par as it relates to current needs from a healthcare standpoint. We're certainly advocating that PAs engage in modernized PA practice laws across the country so that PAs can be able to continue to work on those medical teams to the top of their training, their education, and experience. PAs are part of the solution towards being able to address this, and we have a clear mandate from the public that PAs should be involved in being able to close those gaps towards access to care and ensuring that patients can be able to come in and be seen by a PA in any location at any time.
Absolutely. Well, Mr. Ogunfiditimi, thank you so much for sharing all this great information. If we want to know more, where can we go?
Yes, you can go to aapa.org/patient experience to learn more about what it means to be a PA and how PAs are providing care across the country and closing the gaps around access to care.
Absolutely. Thank you so much for being with us today.
Thank you for having me. Appreciate it.